I block off time on my schedule for these Q&A, so let's go. One of the, probably the most common question is age. Like, is there an age for a facelift? Is there an age for a neck lift? And I'll tell you, most of the time, it just comes down to your anatomy. There are 30-year-old patients anatomically ready and 60-year-old patients that are not. So focus more on the things that bother you. If, for example, your face and neck don't really bother you, then it's probably not a reason to have surgery, but it has less to do with age and almost everything to do with anatomy. My office is located about 30 minutes east of San Francisco in Alamo. It's in a beautiful area with beautiful foothills. We're in the East Bay, but I get patients from everywhere: San Francisco, Palo Alto, South Bay, like San Jose, from other states, even Southern California and beyond. So come in. I'm happy to see everybody. One of the reasons why scars tend to look worse behind the ears is because after the muscle is manipulated during a facelift, the skin is tailored. So we cut the skin and then we just redrape it over. But the area behind the ear can sometimes put the scar or put the skin on tension. Scars tend to form the worst in areas of tension. Now, remember, people are not going to do facelifts routinely if people scar poorly. And it is the most common concern of most people, but I'll tell you, these scars generally heal very, very well, even when they're in areas of tension, even if the skin doesn't even make it sometimes. If the edges of the skin die, I'll tell you, they still can sometimes heal well. We've got lasers and other technology. Now, obviously, you want the scar to look perfect and clean and gorgeous when everything is done, but just remember there are lots of options if you feel like the scar is not to your liking or if that's the reason why you're concerned about surgery. Let's talk about what actually a face or face and neck lift address. So a face and neck lift addresses particularly the laxity in the face and neck in this area, which is the midface, the jawline, and the neck. What it will not address really well is smoker's lines or lines around the mouth. That really takes something like laser resurfacing to help buff that area out. But a facelift will address some of the nasolabial folds, although you'll still have them, some of the marionette folds, which again, you'll still have. But the idea is not to make you look younger or 20 years younger or anything like that. The idea for any of these surgical procedures is to look like a refreshed you today. You today with having just come back from vacation or a full night of sleep. We're not trying to take away age or time. You'll still have lines and wrinkles and all of the things that come with age, but you'll just look refreshed and look the best that you can at that age. Answers can only be given to questions. If there are no questions, there's not a lot I can do, so drop your questions below and I'll get to them. See you next time.